Dani Gasparini, and welcome to this segment of Penn Voice. I'm joined today by Kitty Lopez, who is the Executive Director of First Five. Kitty, thanks for joining us again.
Thanks for having me.
So, you were on the program a few years ago telling us a little bit about First Five. So, for those few people that didn't watch the first interview, tell us a little bit about First Five, and then we're going to jump into what you've been doing.
Okay. Well, First Five, as you know, is one of the largest investors in children in San Mateo County. Back in 1998, when Proposition 10 was passed, it put a tax on all tobacco products. And those monies are to go back to each county in the state to help fund programs and services for young kids 0 to 5 in the areas of health, early learning, family engagement, family support, and then larger system changes and system-wide developments. So next year we will celebrate 20 years, and we will have invested $150 million into our county. Every county has a First Five in the state, and collectively the state has contributed $10 billion. It's a lot of money for our kids in the state of California.
So, and what I like about each First Five is you really decide what your local initiatives are and how you will invest those monies based on what your community need is.
Right.
So tell us a little bit specifically about San Mateo County and what you identified 20 years ago as greatest need and how that is still relevant today.
Well, you know, I mentioned those 4 areas that we work in, that we have to per the statute. But some of the agencies that you know, we do fund direct services. We don't provide that. We know that we have good community-based organizations like Ravenswood Health Center, Gate Path works with children with special needs, Family Connections. Family Connections has a parent participatory preschool. Star Vista does home visiting and early childhood mental health. We work with our County Office of Education, Health Services, and Human Service Agency.
Right, so we know how First Five was originally funded through the tobacco tax. We know that tobacco taxes typically have been going down in the state of California.
Which is a good thing, yes.
Because the other initiatives are doing well in smoking cessation and smoking campaigns, anti-smoking campaigns. So your funding has been changing and evolving, but you're also bringing in newer partners locally to help fund various initiatives. How is that all working, and what are you gaining from those outside partnerships as well, funding partners?
Well, we know that our money, even in the peak periods, was not going to cover everything that's needed for young kids and families. So we have to partner with other entities. And I think, you know, it's a very collaborative county that we have in San Mateo. Every county is a little bit different, but our County Office of Education, for example, is a lead agency working with a number of partners. We help fund that, but they're leading a lot of our efforts in quality early childhood education. So we have helped fund that and direct those dollars.
So what do we need to know about our young children?
Well, you know, there's a growing body of evidence and research that has been done over the last 20 years that we've been doing this, from neurologists, from economists, from scientists that say that 90% of a child's brain is formed by the age of 5. So we have to really invest and spend time and resources in those critical years, because they really do matter. It's not just a little baby sitting there. All of the things that happen to that child and that family matter for that child's success in school and in life.
Well, and I think we can also say that what matters to the longevity in their health and well-being also matters within their first 5 years of life. So the same could be said for their medical and their health abilities, so access to early health, even to mom when she's carrying the child, as well as, and you and I were chatting a little bit, something that's always forgotten is sort of dental care, which is really one of the first forms of a healthy child is through their oral care.
Right. We actually were part of a long strategic planning process just centered around oral health, and brought around the table, you know, 100 providers and our health system and healthcare districts to try to look at what do we need to do for dental care. And so we are supporting some key staff at the health center, our health system, to really address oral health, because there aren't enough dentists that cover Medi-Cal and Dental Cal. And as you said, dental problems are one of the key problems for kids as they go into kindergarten.
Well, I think there's statistics out there that oral care is the single largest preventative health care. So that's where many disease states can start, is
Correct.
with poor hygiene and poor dental care early on.
And if kids are in school and they're missing school, a lot of times it's because of health reasons. So that's why that health and early learning and the family support, they're all interconnected.
So if you're a family that doesn't have children 0 to 5, why do I care about these issues? What's the community benefit to all of us ensuring that we've got programs like First 5?
Well, I think we all have to be invested in our future. I know it's kind of a cliche to say, but really children are our future. And if we don't spend the money and the investment and the resources now, we may pay for that later. There are increased juvenile justice costs. There are increased special ed costs. If we can address problems early and intervene early, we can avoid spending money later on.
Right. So beyond that, it should matter to all of us because that's the society that we have.
Right.
Really, there's an economic benefit in the long run to having a healthier, engaged, and learning community.
Right.
Obviously, as you said, the children are our future, and they are our future leaders. So we want them prepared and learning and healthy and
we'll
ready.
pay for it in a good way, or we'll pay for it in a bad way.
So you and I can retire.
Yes.
Selfishly.
Yes.
But anyway, I want to ask one last question: is how do people get involved? Because you aren't the program service organization. You're not a 501c3 nonprofit. But how do people get involved to ensure that they're also learning and enriched by these kinds of programs?
Well, I think people get involved in their local nonprofits and agencies that work with young children. People can volunteer. People can get involved in their schools, their child care centers. You know, we also need parent advocates and voices as we talk about these issues in local and state governments. It's hard for parents to have the time to do that, but we need their voice and their contribution to what's important for their kids. You know, kids don't go to First 5 Commission meetings, they don't go to City Council meetings, they don't go to Sacramento. So we really have to fight for them and be their advocates to help get what they need so that they can thrive in school and in life.
Well, I do want to talk about one program that First 5 is a part of, and that is the Big Lift.
Yes.
From time to time, I've had some interviews with Carol Groom, Supervisor Carol Groom. Tell us a little bit about the Big Lift and how First 5 is involved.
Well, the Big Lift, as you know and have learned, is a county-wide initiative. I mean, there are maybe 300 organizations and the Board of Supervisors and cities and foundations and all of us working to improve third grade reading. Nearly 50% of our third graders in San Mateo County cannot read at third grade level. And so we have to start earlier. And it's been shown that 2 years of quality preschool can help get kids ready so that they're reading to learn by third grade. So First 5 has contributed almost $5 million to that effort from 2015 to next year, 2018. To support quality early learning in the many communities throughout the county that are working on this.
So when will, I mean, obviously there'll be sort of community reports and sort of talking about what's that data and how this has been affecting our school-age learning. So will you come back on and share some of, I mean, can we dedicate a whole program to Big Lift and sort of talk about what we've been learning now that it's had some time to percolate?
Yeah, actually the RAND Corporation is going to be doing the evaluation piece and working with Silicon Valley Community Foundation, the County Office of Ed, and then the County of San Mateo.
So direct our viewers to where they can go to learn more about the Big Lift and as well as your work with First 5.
Well, they can certainly go to our website, first5.org, first5sanmateo.org, and then the Big Lift has its own website.
Okay.
And I can get that to you.
Well, we'll put it on the end of the program so we can make sure that our viewers
and there's quarterly meetings. The community is welcome. We've enlisted help from corporations and from many people throughout the county.
So again, that voice, we need your voice. We need all people involved in these. Thanks again, Kitty, for joining us on Penn Voice. And we'll see all of you next time.